Good day, everyone. I am Melody Bantayan, and I will be presenting to you the topic that was assigned to me an infant drug dependent mother and alcoholic exposure. Okay, so I know every one of us already have an idea of what will happen if pregnant women or those mothers that uses drugs or any drugs na wala jud gi-prescribe sa ilahang mga doctors and katong pregnant women pod nga nagainom og alcohol. In short, katong mga individual mothers na naay unhealthy habits while still buntis pa lang sila. We know that naa-joy consequences ang ilahang actions and we know if asa mag-lead ang ilahang mga actions. Possible magka-birth defects or worst case scenario, it will lead them to death. Infant of a substance-using mother. Maternal substance use may consist of any combination of drug, chemical, alcohol, and tobacco use during the pregnancy. On this, it highlights the critical role of the placenta in fetal development and the potential risk associated with exposure to toxins during pregnancy. While in the womb, a fetus relies on the placenta as its primary source of nourishment and oxygen. The placenta acts as a bridge between the mother and the developing fetus, facilitating the transfer of essential nutrients, oxygen, and hormones from the mother's bloodstream to the fetus. However, the placenta is not selective in what it transfers. Along with vital nutrients, any substances present in the mother's bloodstream, including toxins from drugs, alcohol, or environmental pollutants, can also pass through the placenta to the developing fetus. This means that if a mother consumes substances that are harmful or toxic, they can potentially reach the fetus and affect its growth and development. Exposure to toxins during pregnancy can have detrimental effects on the developing fetus, leading to a range of health issues and developmental abnormalities. For example, alcohol consumption during pregnancy can result in fetal alcohol spectrum disorders or FASD, while exposure to certain drugs can increase the risk of birth defects, neurological impairments, and other complications. So it's really essential for expectant mothers to prioritize their health and well-being during pregnancy by avoiding exposure to harmful substances and following medical advice to ensure the optimal development of their baby. Healthcare professionals can provide guidance and support to help mothers make healthy choices and minimize the risk associated with toxin exposure during pregnancy. Now let's talk about the signs and symptoms seen in an infant of a substance-using mother. Indeed, babies born to substance-using mothers can experience a range of short and long-term effects, particularly related to withdrawal symptoms shortly after birth. Here's an elaboration on the short-term effects. First, we have mild fussiness. Some infants may exhibit mild fussiness as a short-term withdrawal symptom. This can manifest as increased irritability, restlessness, or difficulty soothing the baby. Then we have irritable or jittery behavior. More severe withdrawal symptoms may include pronounced irritability or jittery behavior in newborns. They may appear excessively agitated, have remorse or shaking movements, and struggle to settle or sleep. Then we have feeding problems. Babies born to substance-using mothers may experience difficulties with feeding, such as poor latch, weak sucking reflex, or refusal to feed altogether. This can lead to inadequate nutrition and weight loss if not addressed promptly. Then another common short-term withdrawal symptom is diarrhea. Infants may have frequent bowel movements that are loose or watery, which can contribute to dehydration and electrolyte imbalances if not managed appropriately. It's really important to note that the severity and specific symptoms of withdrawal can vary depending on factors such as the type of substances used, the duration and frequency of exposure, and whether the baby received any treatment or supportive care after birth. Now let's talk about the signs and symptoms seen in an infant of a substance-using mother. Indeed, babies born to substance-using mothers can experience a range of short and long-term effects, particularly related to withdrawal symptoms shortly after birth. Here's an elaboration on the short-term effects. First, we have mild fussiness. Some Infants may exhibit mild fussiness as a short-term withdrawal symptom. This can manifest as increased irritability, restlessness, or difficulty soothing the baby. Then we have irritable or jittery behavior. More severe withdrawal symptoms may include pronounced irritability or jittery behavior in newborns. They may appear excessively agitated, have tremors or shaking movements, and struggle to settle or sleep. Then we have feeding problems. Babies born to substance using mothers may experience difficulties with feeding, such as poor latch, weak sucking reflex, or refusal to feed altogether. This can lead to inadequate nutrition and weight loss if not addressed promptly. Then another common short-term withdrawal symptom is diarrhea. Infants may have frequent bowel movements that are loose or watery, which can contribute to dehydration and electrolyte imbalances if not managed appropriately. It's really important to note that the severity and specific symptoms of withdrawal can vary depending on factors such as the type of substances used, the duration and frequency of exposure, and whether the baby received any treatment or supportive care after birth. The third significant risk and challenges is the health and developmental consequences. When babies are exposed to drugs or alcohol before they are born, it can cause them to have health problems and make it harder for them to grow and develop like other babies. Some of these problems can happen right after they are born, while others might show up later as they grow up. Babies who were exposed to drugs or alcohol before they were born may be born too small or too early, which can make it harder for them to be healthy. They might also have trouble with things like learning, talking, or behaving as they get older. This can make it harder for them to do well in school, make friends, or feel happy. They might need extra help or support to do things that other kids can do more easily. Then we have challenges for the mother. Mothers who are dependent on drugs or alcohol might have a hard time taking care of themselves and their babies because they are struggling with addiction. Addiction is when someone feels like they need a substance, like drugs or alcohol, even though it's not good for them. For these mothers, it can be difficult to go to the doctor regularly and get the right care during pregnancy. This means they might not know how to keep themselves and their babies healthy before the baby is born. After the baby is born, it can still be tough for these mothers to take care of their babies because they might still be focused on using drugs or alcohol instead of taking care of their baby's needs. Sometimes mothers who need help with drugs or alcohol might not ask for it because they are afraid of what other people will think, or they might not know where to find help. This can make it even harder for them to get better and take care of their babies. So it's really important for these mothers to know that there are people and places that can help them get better so they can take care of themselves and their babies. So the fifth one is the support and intervention. When babies are born after being exposed to drugs or alcohol before they were born, it's really important for doctors and nurses to help them as soon as possible. They look for any problems the baby might have because of the drugs or alcohol. If the baby grows up, they might need more help to make sure they are growing and learning like other kids. This can include things like seeing a special doctor who can check how the baby is growing and learning, getting help from teachers who know how to help kids who need extra support, and talking to someone who can help the baby's family learn how to help them at home. So it's really important for everyone to work together to make sure babies who were exposed to drugs or alcohol before they were born get the help and support they need to grow up healthy and happy. Lastly, we have prevention. Prevention means stopping something from happening before it starts. When it comes to babies being exposed to drugs or alcohol before they're born, prevention means helping pregnant women avoid using these substances so their babies can be healthy. One way to prevent this is by teaching pregnant women about the risk of using drugs or alcohol during pregnancy. When women know how the substances can hurt their babies, they might be more likely to avoid using them. It's also important to make sure pregnant women can get the care and help they need during pregnancy. This means giving them access to doctors and nurses who can help them stay healthy and provide support if they are struggling with addiction. So for women who are already struggling with addiction, it's important to provide them with education and support to help them stop using drugs or alcohol. This might include things like counseling or treatment program that can help them overcome their addiction. In addition to helping individual women, it's also important to have rules and policies in place that can help prevent substance use during pregnancy. These rules might include things like making it illegal to sell drugs or alcohol to prevent women or providing extra support for pregnant women who are struggling with addiction. By working together to educate women, provide support, and create policies that can help prevent substance use during pregnancy, we can help more babies grow up healthy and happy. The way doctors treat babies who were exposed to drugs before they were born depends on the kind of drugs their mother used. Some babies might need special care to help them feel better after they are born. One important thing doctors do is to make sure the environment around the baby is calm and quiet. This means they might limit loud noises and bright lights to help the baby feel more comfortable. Doctors also know that babies need lots of love and care to help them grow and feel better. This is why they encourage things like holding the baby close to the mother's skin, called skin to skin care, and breastfeeding if the mother is in treatment and not using drugs anymore. This special care can help the baby feel safe and loved. Sometimes, doctors might also give the baby medicine if they need it to help them feel better. This can be especially helpful if the baby is having a hard time because they were exposed to drugs before they were born. So, overall, doctors will do whatever they can to help babies who were exposed to drugs before they were born feel better and grow up healthy.